So the Virtual Rural Generalist Service is an Australian first virtual care team that are designed to be able to support communities where there is either no local doctor or where local doctors require a helping hand. So the Virtual Rural Generalist Service work collaboratively with nurses at the bedside, and they utilise a range of technologies to be able to deliver care.
We can be the eyes and ears for the doctor at this end, while physically not having to have the doctor on site. So they can cover multiple sites and provide advice not only just for one health service, but for a lot of health services with one doctor.
It's not there to replace clinicians on the ground, it's there to support those communities where there is either no local doctor, where the local doctor's gone on leave, or whether they simply require fatigue management. They're able to help doctors when it's needed, but also when we are unable to get a doctor on the ground because of workforce gaps or because of a vacancy in a position, we're able to get someone at the bedside virtually with the nursing staff to be able to provide safe and high quality care.
Several months ago I had a reaction to a COVID needle. I had the COVID needle on the Friday, and then on the Sunday I was just shaking all over from head to foot. Couldn't stop shaking, I couldn't drive a vehicle, I just couldn't hang on to the steering wheel. And a wife brought me into the hospital. There was no doctor in town at the time. They came in all suited up and with masks and everything, and I thought, this is it. However, they then wheeled a TV screen in and I was able to talk to a doctor, and for the next 7 days I had a doctor wheeled into my room every day, and I'm quite impressed with that, yeah.
So VRGS is a 24-hour a day, 7-day a week service, so we always have access to high quality medical services, and I think that's important for rural and remote communities.
It's really reassuring that you're not the only person that's laying eyes on the patient. Someone else gets to visualise them and what's brought them into hospital. It's reassuring for the patient for the same reason, and it also helps the elderly population who are very used to being able to see their local GP whenever they want to, and they get that reassurance of actually seeing the doctor, not just the nurses that they may or may not know.
They had the information in front of them, they had the blood test results, they had the other results of things that they'd done. They weren't sort of grasping to say, well, what are you doing here? They were all on top of it. I was quite impressed with it. Thank God for technology, I've worked and travelled in very isolated areas, and I could see this being a great asset to Western New South Wales in particular.